All right, Dr. Robertson.
Thanks, Taylor. Good afternoon, everyone. So this week within CHI Health, we started off the week with 170 COVID positive inpatients. If you recall, right before Christmas, the last time we met, I think we were at 192. So we've seen a continue but slow decline in the number of folks requiring hospitalization. This week, actually, we kicked off the second dosing of the Pfizer vaccine. So as you all know, the first dose we started back before the holidays. Those individuals that were vaccinated have now made their 21 days and are now we're now in the process of giving people the second dose, or the booster, if you will. Within CHI Health, we vaccinated now close to 7,000 employees. That's about half of the total workforce. We are expecting more shipments of the Moderna vaccine this week and next week, and we'll begin in parallel running vaccination clinics that will be for second doses for folks that got the first dose of Pfizer, and then starting probably in a week or so, we'll start another round of first dose vaccinations with the Moderna vaccine. And again, the last 4,000 or 5,000 people to be vaccinated within our health system are generally the folks like I am, which are not involved in direct patient care, kind of more administrative or back office roles, if you will. We're the folks that didn't qualify for kind of the first round of vaccines, just based on our risk profiles. Again, a lot of people ask questions about side effects. Within our organization, the side effects have been pretty consistent. Anecdotally, what I'm hearing are, sore arm. We've had some people report headaches or feeling kind of flu-like for 24 hours. What's interesting is that almost everybody notes that the side effects seem to resolve fairly quickly, meaning they may feel out of sorts for a day or a day and a half, and then it just resolves and they feel back to normal. We've done an informal survey, and about 80% of the staff of our staff have responded to the survey, have said they ultimately want the vaccine. So we feel pretty good about the acceptance of the vaccine, at least within our CHI Health family. We do know, though, that nationally there is some reticence, and there are a lot of folks that are hesitating to get the vaccine for various reasons. I think we're feeling more comfortable today than maybe even 3 weeks ago that ultimately we'll be able to vaccinate the vast majority of our caregivers and support staff. So I'll stop there, Taylor, and see if you've got questions for me.
Yep, we'll go ahead and jump right in. The first question, I have a few submitted from the Associated Press, and you just touched on this a little bit, but have you had any CHI Health employees who are eligible for the vaccine refuse to take it? If so, how many have refused to take it?
I don't have those exact numbers. What we are trying to do as an organization is really be able to circle back and kind of compile that information, because it is important to us. Anecdotally, what we've heard is there are people that said, hey, I don't want to get the vaccine right before Christmas, just in case I have side effects. It's the holiday, blah, blah, blah. So we've had some of that. We fully expect those folks now to get back in line, if you will, to get vaccinated in this next round. We do have some folks that have expressed the reticence to get the vaccine because they had COVID. And as you know, the recommendations are people need to be at least 90 days out. So there are folks that we've identified that will ultimately get vaccinated, but for now have said, they want to wait another month or two before they get vaccinated. We do believe, and we've seen the data nationally, that we do believe that, there are different subgroups of employees that may have, more or less hesitancy to take the vaccine. That's not dissimilar, quite honestly, to what we see every year with the influenza vaccine. But we don't have the exact data yet for our organization in terms of, whether there's certain people that work in certain jobs, or if there's other factors that seem to be correlated with folks' decision to decline the vaccine. But for now, for CHI Health, we're feeling pretty positive that the vast majority of our folks have expressed interest in getting the vaccine and will ultimately be vaccinated.
You just answered the second question that he had about offering a reason why maybe they didn't want to take the vaccine. The third question is, I know you said in the past that taking the vaccine is voluntary for CHI Health employees. What efforts are you taking to encourage employees to take the virus, or I think he means the vaccine, and educate them about the benefits of the vaccine?
So it's a great question. Our national health system, Common Spirit Health, is really interested in making sure that we understand the reasons behind people's decision to not have the vaccine, assuming they're given the opportunity and they decline, so that we can actually develop specific educational or communication tools to help those folks understand the benefits as well as the risks. I mean, obviously, there are still risks. This is a vaccine. It is something that we are injecting into people, and so we understand people. All people probably have a certain level of hesitancy. That's not unusual and probably not even uncalled for. What we're trying to do, though, is make sure that folks have the information presented to them in a way in which they can understand, so that they can make an informed choice about whether or not to receive the vaccine. And so we're trying to identify those key areas or key issues that are creating people's reservations about the vaccine. And once we identify the groups that are declining then it gives us a better opportunity to then understand what kind of information or education might help them get comfortable and ultimately result in accepting the vaccine. So it's a process, but as I said at the beginning, right now the response from our employees has been overwhelmingly positive, and I am going to get the vaccine, and so we're feeling pretty comfortable that we won't have a huge number of employees that opt out.
How does it feel seeing your employees getting that second dose and having even that much more protection from the virus?
Well, it feels great, but it also feels a little bad because I've not yet been vaccinated. I'm at the very end of the line, so I'm glad that folks are getting their second shot. That means we're getting closer to being able to have all of our workforce vaccinated, and we can't, people aren't protected. You don't get that 95% efficacy or protection until you've had both doses of these first two vaccines, the Moderna and the Pfizer. And so it's a wonderful thing to see people getting their second dose, because that signals that we're that much closer to getting back to some sort of normal. So I also think it's been really powerful, the morale impact that the vaccine has had for healthcare workers is palpable. You can hear it and see it and feel it in our teams, because they think we see this is the beginning of seeing the light at the end of the tunnel.
The UK has made the controversial decision to delay the second dose. I believe, I don't know if this is both Pfizer and Moderna, but up to 3 months instead of the 21 to 28 days recommended by the FDA due to supply shortages. Is this something CHI has considered to make supply stretch, or is that not even an option?
It's not something that we've considered. I mean, obviously, we see the news and had been notified that this is something that's being considered in other countries. As of now, we're not having issues in terms of accessing enough vaccine to take care of our workforce. So I think that, and I think the other issue that has been raised that you've seen in the media is about not even using a half dose as a way to conserve vaccine. We're not considering that. We're not going to do that either. We're going to follow the FDA's recommendations in terms of 2 full doses at the appropriate spacing and aren't going to deviate from that.
What are the benefits of getting both doses, and how important is that?
Well, I think if you go back to the original release of the trial data, with the 95% effectiveness really comes only after an individual had received the 2 doses. I think there was, numbers quoted in the 50% range after 1 dose. And while, that may be, in line with what the annual seasonal flu vaccine provides in terms of protection, we believe it's critically important to get the maximum benefit out of this technology, out of the vaccine. And the only way to do that is to follow the recommendations from the FDA in terms of giving the 2 doses. So, this is an incredible development to have a vaccine that, appears to provide 95% of protection. And so we think it would be, wouldn't be the right thing to do to not do everything we can do in our power to make that available to our first our employees and our staff, but ultimately to the general public.
This is from Channel 8 in Lincoln. We asked Governor Ricketts this morning about the fact that there is a lot of doses of the vaccine, but not many have received them. The governor said, due to the holidays, weather, etc., is the reason why they aren't being distributed as much. As a hospital system, do you agree with this?
Well, vaccinations, even internally for our staff, that did slow down that week between Christmas and New Year's for a variety of reasons. But there's no vaccine that has gone to waste inside CHI Health. We've been able to, every dose that we've received that's been allocated to us, we've been able to get into the arm of one of our caregivers. And so while others may be having issues, we're not. CHI Health has not. And so we're ready. As I said, we're ready to receive our next shipment of the Moderna vaccine, and we'll subsequently be starting our next round of first dose clinics, while we at the same time have a whole separate set of vaccine clinics that are administering second doses of the Pfizer vaccine to those that have already been immunized or vaccinated, with the Pfizer vaccine. So we've not run into that difficulty as of yet, and we're able to distribute in every dose that we've been allocated so far.
I have a couple of questions in the chat that are kind of similar, so I'll just kind of lump them together. Do you think we're receiving an adequate amount of vaccine shipments, and are we satisfied with the pace of vaccinations in the state? State numbers show only about 40% of the vaccines Nebraska has gotten have been given out. Is this happening quickly enough? So are we getting enough? Do we feel like we're receiving an adequate amount, and is it happening quick enough?
Ideally, if there was a way to do it, the perfect outcome would be to vaccinate everybody in Nebraska all on the same day, all at the same time. But obviously that's not logistically feasible. So yes, we would love to be able to vaccinate more people faster. But that said, I think given the structural limitations of what it takes to vaccinate thousands and thousands and thousands of individuals, I think we're doing a pretty good job in this state and in this region. And but it's it's not perfect, but it also probably we couldn't expect it to be perfect given the magnitude of what we're trying to do. I think the next couple of months will really be critical in terms of our ability as healthcare providers in the state to come together, to work very closely with the state to vaccinate as many people in the general public as possible. That's going to be the true test. I'm sure it will come with an occasional bump or two, but I do know the commitment of not only our organization, but of all health systems in Nebraska. The commitment is there to do whatever it takes to vaccinate as many of our fellow community members as possible, as quickly as possible.
Has CHI Health seen the variant form of COVID-19 in Nebraska?
We've not identified the variant, the UK variant I think you're referring to specifically. What we've learned is what I think now is generally public knowledge is that, there's a fear that it may be more this variant may be more transmissible, may be easier to, infect between, two human beings, but doesn't appear to have any more lethality and should in fact be be susceptible to the immune response that the vaccines are creating within those that have been vaccinated. So, as I've said, I think we as an organization have gotten comfortable with the idea that COVID will be with us for a long time. It may, it will hopefully decline to a very low level in the community, and it'll be an occasional infection. We'll have a few patients any given day in the hospital, maybe with COVID pneumonia, but we don't envision it actually absolutely just going away and not, being non-existent. So as a health system, we're prepared to deal with COVID and patients that are infected with that virus, into the future. What we do expect, though, is that as more and more people get vaccinated, we will begin to see, a declining number of infections. And with that comes fewer people in the hospital, fewer people requiring ICU care, and fewer deaths. And that, that we think is a likely outcome. Probably more, we'll start to see that late spring, early summer, and hopefully by the fall, COVID will just be at a very low level in our state and in our region.
There has been a decline in COVID-19 testing in many places. Has CHI Health been seeing this, and any thoughts on why testing is declining even though positivity rates are remaining very high, especially in the Lincoln and Omaha areas?
I don't know that I can answer that scientifically. I think that just anecdotally, as I mentioned before, I see our daily test results every morning. So and I think yesterday we ran 350 or so COVID tests across all of our communities, and those were tests just in our lab. That's not Test Nebraska or any other commercial lab. And our positivity rate has fallen pretty dramatically from about 6 weeks ago, but is still bouncing around 20%. That's what it was as of yesterday. Yesterday's test, about 1 out of 5 were positive. So there may be less testing because there just may be fewer people with symptoms that are presenting to be tested. Maybe because there's not as much contact tracing that we're doing because we don't have as many active cases. There's a lot of variables that probably drive the number of tests that are being done on any given day. But it is safe to say that our positivity rate is not back to where it was 4 months ago, which was in the low teens on a percentage positive basis. We've been bouncing around in the 16 to 21, 22% range positive within the tests that have been run in the CHI Health labs. So it is still out there and it is still prevalent, but a little less so than at our peak when we were in the high 30% positivity range.
With COVID guidance in place, have you seen a drop in flu cases at CHI Health, and are you still concerned, about seeing a rise in flu cases during the pandemic?
So, I think I mentioned a few months back that we were seeing data coming out of the Southern Hemisphere that the flu season had been very mild compared to average, compared to the norms. I would say that so far through the end of December and now into the 5th day of January, we are having that exact same experience, at least within CHI Health. We have not had an admitted influenza patient yet this year. That is very atypical. Usually by December, we're starting to have, flu cases in our clinics, which we may still be having, but generally we will have people get sick enough to require hospitalization. We've not had a hospitalized influenza patient yet, and that's atypical. So the things that folks are doing to mitigate the risk of COVID seems to have worked very nicely to mitigate the risk of influenza at the same time.
Hospitalizations are much lower in the state today than they were just a month ago and have been dropping for the most part. Do you believe we are past a fall/winter peak?
I hope so. I think I think it's interesting if you look at the patterns of these surges that occur both in our region, but as well as other parts of the country, particularly parts of the country where Common Spirit has health systems where I have access to some of their data. These surges have seemed to run 6 to 8 weeks. And then for whatever reason, maybe it's the public interventions, maybe it's the things that we as individuals start doing, more effectively, this increase of the number of cases and then subsequent hospitalizations seems to peak out at about 6 to 8 weeks. And it seems pretty consistent in other parts of the country where they've had, their surges. And so I am hopeful that, we didn't see a surge after Thanksgiving like many predicted. And I can't really explain that other than, we had already kind of hit our peak right before Thanksgiving, and we're already starting to sort of plateau and decline. And our case counts across the state, as well as the number of patients in CHI Health hospitals, has declined, from that peak. We're about 50% of our peak, 6 weeks ago. That, now we've been, around the 170 range now for about 4 or 5 days. So, I don't know that it's not turning a different direction, and we may start to see more cases and more people hospitalized. But I'm hopeful that we'll be out of the woods for a little while, and we may have, another peak in 2 or 3 months. It's hard to know how this virus is going to act. I do believe that the vaccination program will absolutely help, and I'm hopeful that we have enough people in Nebraska vaccinated, through the month of January and into February, that really forestalls any major, surges later in the spring. So it was a long answer to, I don't know whether we're going to have a post-Christmas or post-New Year's surge. We didn't have one after Thanksgiving. That might have been because we had just kind of sort of hit our peak, and the virus seemed to have been waning already. We'll know at the end of January whether we we were able to avoid another surge as a result of the holiday period. But as of now, I think we're going to see continued decline in hospitalizations, and hopefully the positivity rate will continue to decline as well, because that's a leading indicator.
What role will CHI Health play in the distribution of the vaccine in phase 1B, 1C, et cetera?
I don't know that it's 100% clear yet, other than that we are absolutely committed to work with the governor and the state, and we'll do whatever we're asked to do. So, we absolutely have obviously the technical expertise and the people resources to do more widespread vaccination. We have planned internally that our 157 clinic locations across the region, can absolutely take some of the responsibility for vaccinating the general public once we get to that point. Particularly when we, with the Moderna vaccine, where there isn't that ultra cold storage requirement, it'll be much easier for our ambulatory sites to really take the lead as part of the vaccination program. but we will not do it by ourselves. We will participate lockstep with the other health systems in working with the governor and the chief medical officer of the state.
Couple more questions as we near the end of the call here. Test Nebraska turnaround times are shorter than they've ever been, with many people getting results back in 12 hours or less. How have the lab technicians been able to make this happen?
It ends up being about capacity and staffing. So there's two things that drive our ability to do turnaround at Test Nebraska, and that is having the equipment. So having the machines available, or that capacity to run the tests. And then obviously there's still a human resource or a labor component, and having adequate and trained staff to be able to rapidly take specimens in and process them and get those results out quickly. So I don't know that there's not really any special magic. It's just about having a refined process of both intake as well as getting the results back to the individuals, and having the both machine and human capacity to take on the volumes of tests that come to Test Nebraska. So, again, another example of something I think the state has done very well in making that move very early to work to create that capacity as a resource for for health systems, and for actually, quite frankly, for the communities across the state. And it's great to see that we're now at a place where we can turn tests around in less than 24 hours. That's, I think, about as good as it gets probably anywhere in the country.
And then the last question is, do you know if our shipment numbers fluctuate in terms of how many doses we're able to get from either Pfizer or Moderna? Do those fluctuate, or are those determined by the health department? How does that work?
Yeah, I think the ultimate determination starts at the state and the health departments. There are situations where a county may have doses that have been allocated to, say, first responders, and they had more than they needed, and those doses might come back to then one of the local health systems to be used on healthcare workers. So there's been a little bit of that, but we received our shipment of Pfizer, dose number 2, and my understanding is it's the exact same number of. I mean, it's perfectly set up, so it's the exact same number of doses as we got with our first shipment, and obviously that's by design, because we should be vaccinating the exact same number of people for their second dose 21 days out. So there might be some variation, but that's driven at a kind of a level of above the health system. That's driven at by the county health departments in conjunction with the state.
Any closing thoughts, Dr. Robertson, before we wrap up this week on where we're at with the vaccine or anything else?
Only that I would just strongly encourage folks to take the vaccine when it's offered to them. For those folks that have questions, there's tons of publicly available information that's valid and reliable. There's even data from the original trials that you can easily access to educate yourself. But I do believe that the vaccine is a step. It's the first step towards the end of this COVID experience. And the more of us that can get vaccinated, and the better off we'll be. And as I think you've seen, physicians and nurses across CHI Health who are obviously very familiar with the science have, in leaps and bounds, been very comfortable stepping up and getting the vaccine and sort of leading the way. And so I just hope that folks, continue to mask and to wash their hands and to practice social distancing. But I also hope folks will take the vaccine when it's available to them, because that will make a difference as far as this pandemic is concerned.